Do breast implants decompose when you die? I don't know if I ever considered this. Like, what happens to them? Will you be a skeleton with 2 orbs?
You will be a skeleton with 2 orbs. You will be a very busty skeleton.
Hi, everyone. You can see I have a guest.
Hello.
This is Dr. Killeen. She's a board-certified plastic surgeon here in Los Angeles. I have been following you on social media for a while now. You started, like a couple years ago?
A couple years ago.
Yeah, going really hard on TikTok. She really debunks myths about plastic surgery and just kind of, you have commentary on a lot of things around plastic surgery too, right?
Yeah, I just want to empower women to make good decisions with good information and go into a plastic surgeon's office and get all their questions answered.
And that is why today she is answering all of your breast augmentation questions. I asked you on Instagram. These are the questions that we gathered, and she is going to answer today.
Let's do it.
Let's go with question number 1. I'm going to read off my list because there were a lot of questions. Okay?
Great, I'm ready.
Implants. That's where we're going to start with. This person says, curious about your take on breast implant illness. So we're going to go hard with the first one.
We're going to go hard with the first one.
Is breast implant illness, is it real? Is it not?
Oh, it's absolutely real. So
okay.
I think it's important to remember that any time in life when you make decisions, there's no perfectly good or perfectly bad decision. There are pros and cons to everything. And there are some women that absolutely do not do well with implants. So breast implant illness is a real thing. The unfortunate reality is we don't have diagnostic criteria. There's no tests. There's no way to know as you as an individual might get this. It is not horribly common, although sometimes their advocates are very loud online. We don't see it a lot in real life. I take care of those patients, but most patients with breast implants are very happy. It's important to know, though, that if you don't do well with breast implants, that removing your breast implants will improve your symptoms in most patients. So if you think your implants are making you sick, you always follow up with your plastic surgeon. You want to make sure that you rule out other health conditions. And then if it looks like the implants might be the source, then you take them out.
I always kind of remembered wondering, is it because it's leaking? But even though they can't really leak since they're more of a gummy material, are there any studies or anything that show what could potentially be causing it?
Great question. And yes, there are. So as of a couple years ago, a group spearheaded by women with grants that were not funded by industry, they came from an educational grant, they did a series of studies to try to flush this out. And so here's what we know. We don't know what it is yet or why it happens, but we know a few things. It doesn't look like it's silicone because rates are just as high in silicone implants as they are in saline implants. And they recently did a study where they looked at gel bleed, because even if they're not broken, the silicone can bleed. And they found no gel bleed in the capsules of saline implant patients, yet they still get breast implant illness. They looked at heavy metals and they found that women who have never had implants, women with breast implant illness, there's no difference in heavy metal levels in their bodies.
Okay.
They looked at autoimmune markers and found that there was no difference there. They looked at biofilm and they found nothing there. We don't know yet, but we're checking things off the list, which is really important. And there's good research being done. And again, it's exciting. It's being done in a way that is not sponsored by implant companies. And it's being spearheaded by a bunch of amazing plastic surgery women who are working, not being paid, working to figure this out for their patients.
So they're truly just passionate about it.
Absolutely.
But like you said, it goes away once you remove them, right?
In most patients, they feel better. Yeah.
So easy.
That's what the studies show.
What is the most natural looking kind of implant is another question.
So I think the easy answer for this is the implant that fits your body properly. So the way to make an implant look good on your frame is that its dimensions are such that it fits your chest properly and your breast footprint properly so that it looks like it belongs to you. I think things get weird if the implant is too narrow. Things get weird if the implant is too wide. And then you start looking less natural when the implant is very projected, which is a higher profile implant. And we usually don't use those in a normal augmentation patient unless they want a lot of volume. And those patients usually aren't looking for natural anyway.
That's very true. I remember I was so surprised by this because you think about the implants, and then we went and started filming some breast augmentation videos in the OR, but we went through the whole process with the patient, and it never occurred to me that you shouldn't be looking at the implant as this blob sitting on the desk. You should hold it up because you're going to be upright.
Exactly.
And this is how it's going to fall. And that was so surprising to me because, of course, that makes sense. But I don't think the average person considers this.
No, the average person doesn't. And that also can play into how natural it looks. So implants that are more soft, they settle more like a natural breast. And the implants that are more cohesive or firm, they keep that upper pole roundness, which is a little less natural. But some women want that. So there's different types of silicone in the implants to try to get you the best result possible.
How often should we replace implants? Because you have to eventually, right?
Yeah, so the reality is with every study that's ever been done is that we know implants are not a lifetime device. And the reason why is because they break at some point. So we know that in the older generation of implants, which we have the longest term data, they start to get weak year like 8 to 11, and then they start to break year 11 to 14. So you can decide as an intelligent human being what makes sense for you. So if you are risk averse like I am, I prefer to switch them out before they break because I do not want to deal with rupture related complications if I can help it. So typically that would be probably 10 to 15 years after your initial augmentation. And that's what I recommend. Now there's women that are like, throw caution to the wind. I'm just going to wait and see if something happens.
I know a lot of women like that. That's why I'm kind of like smiling because I'm like, most of my friends are probably
I see patients that have, 20, 30 year implants. And you certainly have the potential to develop more problems if they break and then you allow them to be broken. So you just have to keep in mind, if you're going to be that girl, follow up with your surgeon on a regular basis, do your imaging if you have silicone implants so they can monitor for rupture so you'll know about it before you develop symptoms.
Yeah, that makes complete sense. It never even occurred to me that maybe you shouldn't wait till there's an actual issue. There are questions kind of related to this. Mine are past the 10-year mark. Do I need to see a doctor? There's no issues. They're just saggy. They're just saggy, that's all.
It really depends on whether they're silicone or they're saline. So if you have saline implants, there's no issues. You can not see a doctor. I mean, I would love for you to follow up with your surgeon. I think we would love that, but you don't have to. Now, silicone implants, because you do need to get imaging, you should follow up with your plastic surgeon. So the FDA recommends after 5 years, you start doing your imaging, and then every other year after that, either an MRI or an ultrasound. Most plastic surgeons can do the ultrasound for you, like I do my own patients in my office. And then I like to go to yearly at 10 years because we know that the rupture risk goes up. So you might as well come in every year. And you can also get it done at the time of your mammogram. Many mammogram places will actually add it. So you can do mammogram, ultrasound, off you go.
Ah, that's good to know. All right. Somebody's asking gummy bear versus silicone. But are they the same thing?
They're the same thing. Okay. So gummy bear implants are silicone implants that are just more cohesive. So they're firmer, they're less like jello, they're more like a gummy bear inside. So most of us use gummy bear implants. All of the implants on the market are cohesive these days. They're just how cohesive are they? So the cohesive implants are great for women that are very thin. They minimize rippling. And the softer implants are great for looking more natural with women that have more breast tissue naturally because you won't see the rippling if it happens.
Yep.
So all of these are silicone. They're awesome options. You just have to figure out which one works for you.
Got it. I think the question should be more so silicone versus saline, really?
Right. Yeah, saline implants are just an inferior device, which is what every plastic surgeon will tell you. They don't look and feel as natural as silicone. The main benefit of saline is that it's less expensive, and if it breaks, you know, because your breast goes flat, and all of a sudden you wake up with your breast gone.
That would be wild to me. It just disappears.
Yeah, I always tell this story. I have a patient who woke up on her 40th birthday with a flat breast. Like, welcome to your 40s. Bye-bye boobies. So sad. So saline implants, that's why you don't have to monitor them because you know if they rupture. And they're higher chance of rippling and they do feel like a bag of water in your chest. But if you have enough breast tissue to hide that, you don't notice it as much and people do great with saline implants. So it's just important to talk about what things are important to you. Feel the implants in the surgeon's office, figure out which one you like the feel of more, and then go from there. I've had both personally. I've had implants for 25 years. So I got saline and then I switched to silicone, and then my last set is silicone too. And it's just it was a big difference. I really like my silicone implants a lot more than I like my saline implants. But if I have a patient who has saline implants and love them, I'm like, just stay with them because they're so much less problematic if they do break.
Speaking of rupturing though, are there signs to know, we obviously know now that saline will just deflate, like it'll be gone.
Go flat.
And so how about with the silicone implant? Will you know if there's a rupture?
So sometimes no. Sometimes they rupture. It's called a silent rupture. That's what I had my last surgery. My implant was ruptured and I had no idea. So no symptoms, silent rupture. Some people develop pain. Some patients get capsular contracture or tight, hard scar tissue that can form around the implant. Sometimes the silicone, especially the older implants, this doesn't happen as much with the newer ones, can get in your breast tissue and make lumps, like painful masses in your breast.
Ooh,
so it can be really problematic when these things break, especially the older versions.
But again, now we know we need to start monitoring.
You start monitoring.
All right. This is a funny question. Do breast implants decompose when you die? I don't know if I ever considered this. Like, what happens to them? Will you be a skeleton with 2 orbs?
You will be a skeleton with 2 orbs. You will be a very busty skeleton. So yes, they don't decompose like your body does. So there was a really famous murder case where they solved it, I'm pretty sure, in like the mid-aughts by looking at the serial numbers on a decomposed body. They found breast implants, and they actually found who the victim was and ended up solving the crime through her breast implants. So
I remember this. I was like,
so
shocked.
You definitely will still have your implants, and they might even find your killer.
Yeah.
Hopefully you won't be killed though.
Yeah. But we now know you can be identified. Something that I think has become a little bit more popular over the last few years with breast augmentation is not implants, but fat transfer.
Yep.
Are you seeing
doing
this
a
more?
lot of fat transfer? Yeah, I do it on cosmetic and reconstruction patients. It's very popular these days.
What do you think of this as a plastic surgeon? First off, this isn't even a question about.
I love fat transfer. I think it's amazing. It has great results when you choose the right patient. Fat transfer is a technique where we liposuction somewhere on your body. You know, we get that big bucket of stuff out, and then we process it, and a certain percentage of it is going to be healthy, usable fat. And then you place that fat in the breast, and then over the next time, you know, a couple days to a couple weeks, it's going to establish a blood supply, kind of figure out life, live right there, and then give you some more volume in your breast. You got to remember though, is the breast is breast tissue and fat. The breast tissue is the firm part that gives your breast structure. So fat is not good for making a breast nice and round like an implant. So if you get fat transfer, it basically takes the breast you have and makes it a bit bigger. And our main limitation is 2 things. How much of a space do we have to put it, and how much do we have to take? Because you don't want to create a problem solving a problem. So if someone is very, very thin, fat transfer is not a great idea because you're going to need to liposuction all over their body, and the chance of making them look surgical or having lumpy, bumpy areas is, I think, doesn't make it worth it, especially if it's going to be a small increase, which it often is for a small patient. Now, if you're very small and you don't have a lot of breast tissue, there's not a lot of place to put that fat.
Right.
And it's not going to get a blood vessel.
Because you can't make like a pocket.
No, and you'll see that. You know, I've seen that on social media, a woman who is very small and is huge afterwards.
From fat transfer?
From fat transfer. And often they're not just transferring fat, they're also transferring fluid, and it looks bigger. You know, those doctors often don't show long-term results. You want to see results that are 6 months to a year at least out, especially with high volume transfers, because the problem is when the swelling goes down and the dead fat that doesn't make it is reabsorbed, you will see the outcome, which is often much smaller, but also often is lumpy because there's areas of dead fat. So you just can't overdo it with fat grafting. Awesome procedure, but you want to make sure you're the right patient. So if your goal is to go up a half a cup size to a cup size, that's a pretty reasonable goal, which is about 150 cc's at most.
Yeah.
So that's not a huge increase. So if that makes you happy, brings you joy, then it may be a great procedure for you.
I was wondering, how do you make them even if you don't know how much fat is going to survive?
So in general, for most patients, they're going to get it. You know, how much take you get is how much of the fat you place lives, or how much of what you put in lives. Some surgeons do just mostly fat, and that's what I do. Some surgeons do fat with a bunch of liquid. So with my fat grafting, I get very high take, 80% or more, and that's consistent because I just put the fat in. And I don't overdo it. I'm not, one of those people putting hundreds and hundreds of cc's of who knows what, where a lot of it doesn't take. So I get very high take and it's consistent. So I can get a very consistent take on both sides. Now, for women that have had breast cancer that maybe had radiation, they're going to get lower take because the blood vessels are not normal on that radiated side. So I will adjust for that with just my experience and my technique to make people as even as possible.
I love that. Now, somebody's asking about fat transfer with a lift. 1, can you do that? 2, does it fall again eventually because you're just putting fat in there?
Absolutely, you can do it together, and absolutely it will and does fall. So anytime you do a lifting procedure, there's a little bit of a shelf life. It's going to come down with time, and how quickly it comes down, it depends a lot about you.
How elasticity, collagen.
Yeah, how much sun damage, smoking, just you as a person, stretch marks, and that affects how strong your tissues are, and are they going to be able to support the weight? Also, how large your breast is and what activities you do. Women that do a lot of high impact activities have more trouble, especially if they're not wearing proper bras afterwards. So everything that goes up will eventually come back down. You can slow the process by protecting your investment with a good bra.
Gravity.
Gravity.
Does fat transfer to the breast have the same risk as BBLs, which is the Brazilian butt lift, or that's like the nickname of it, but that's where they do fat transfer to the butt. So apparently that has a lot of risk to it. So how about to the boobs?
So no, it's a very different procedure. So when you transfer fat to the buttock, the main worry is that fat is going to get in major blood vessels and end up in your lungs. And we call that a fat embolism. And that can be a fatal thing. That can actually cause death in a patient. And it's very scary. We have changed how we do BBLs in the last 5-10 years because we figured out how to minimize the chance of this. But that risk is really because there's such intense vasculature of that area in the buns that we just don't have in the chest. So the risk of having a fat embolism go to your lungs is very, very low. I've actually never heard of that happening in a breast. So it's a much lower risk procedure.
All right, moving on from the fat transfers, we're going to lifts. I didn't realize there are so many things that breast augmentation kind of covers.
So many variables, yes.
Yeah. Do lifts require implants? That's a good question.
That is a good question. And some surgeons will tell you yes, I will tell you no. It really depends on what you want. So if you just want what you have up higher, then a lift is the way to go without an implant. I don't want to put implants in absolutely anyone unless they really need them because it is a foreign body and requires maintenance. If you want to be 2 cup sizes bigger, then implants a great way to go. If you want a really round breast with a lot of tissue up top, an implant is a great way to go. So it just depends on what your goal is for how your breasts are going to look after surgery.
Oh, will a lift result in loss of sensitivity?
Great question. It can. So statistically, about 10 to 15% of patients will lose or have decreased sensation in their nipples after their surgery.
Wait, is this all breast augmentation?
For breast lifts.
Just breast
So
lift.
yeah, for augmentation, it's much lower. It's really common after an augmentation alone to have some decreased sensation for a while just from stretching of the nerves, but it usually comes back after a couple months. But for breast lifts, there's a higher rate of losing sensation. So like I said, 10 to 15%.
Wow, that's actually pretty high, right?
It's pretty high. You know, I will tell you that in real life, it doesn't seem to be that high. It's just one of these complications that's written about a lot in older studies, and we just don't see it a lot in real life.
Okay.
Luckily, we don't want to see that.
Last question about the lifts. There's, that net that is used. This person's asking, are there downsides to the internal bra?
Yeah, so internal bras have been used for quite some time in plastic surgery. So just to be clear, all of these are off-label. All of these are products that were put on the market by the FDA for different things, and we've grabbed them in the field of plastic surgery, which is common in the field of plastic surgery, but they've been used for quite some time. So there's internal bras that are permanent products like dermal matrix. There's internal bras that are dissolvable products like Galaflex, which is my favorite, and Durasorb. So
meaning that it's going to be there for a while and then absorb?
Go away. And so there's some of these products will just go away. Some of them will go away and leave behind a little tougher collagen, which is what I personally like. And so what you're hoping is that, how I said earlier, how everything comes down with time, you're going to slow that process. You create like a little hammock that's going to be a bit of a speed bump. So the time ticks a little slower and it will hit that speed bump and take longer for it to descend.
All right, moving on to breast reductions. Can you still breastfeed after a breast reduction?
So you often can, but many women struggle making enough milk. So I just had one of my adorable patients DM me and she's like, I had a baby and I can breastfeed no problem.
Ooh, good for her.
Love that. Yeah. Love that for her. But that's not always the case. And so it's important to consider that. So we used to tell women, wait till you're done having babies, but you are more than your feeding parts and your baby making parts. And having heavy breasts that cause you neck and back pain and limit your ability to exercise for decades because you might have a kid and might breastfeed, I don't think is probably a good choice. So if you're someone who's young with larger breasts, I don't think that's a reason in itself to not do it, but you do need to understand that there's a potential it could affect it.
Should you be at your goal weight for breast reduction?
Yeah, I think it's always important for any surgery to be at your goal weight because the problem is with any plastic surgery that requires skin tightening, which a reduction does, is that as you lose weight and the fat in your breast shrink, your breast might sag somewhat. So you really want to have the best possible result that lasts the longest. And so being at your goal weight is really important. So you want to be within 10 to 15 pounds of your goal weight at the time of surgery.
And then how long is recovery for reduction? Actually, let's just kind of go down the line of recovery for all the different types of breast augmentation.
So honestly, for all breast surgery, it's pretty similar. So we can just wrap it into one. For my patients, it's pretty similar. So I do a lot of what's called the ARIS protocol, Advanced Recovery After Surgery. Every surgeon does this. Some surgeons name it something fancy and TM it, but it is the same thing. And we do all kinds of things to make your recovery easier. So most of my patients take no prescription pain medicines. I prescribe it and they rarely use it. I use a long-acting numbing agent, which lasts for a few days, and that takes a chunk of the pain away. So just Motrin or Tylenol is what most people need. The first first week is the most annoying, where you like know you had surgery when you get up. So you're up and around, you can go out to eat, go watch a movie. You feel pretty good after a day or two, but you're not ready usually to go back to work or to drive a car. At the 1 week appointment, most patients are like, can I please drive? I'm ready to go. And so I'll release people back to jobs that are sedentary. So they're not lifting heavy things and doing a lot of activity. They can drive a car and, be pretty normal in life, but still no exercise until about 1 month. And the exercise rule is really important for all types of breast surgery, but in particular breast implant surgery. So when I put an implant in, your body will wall it off with scar tissue, and that's called the capsule. It takes about 4 to 6 weeks to form. So if you go nutty with your activity too early on, your implant will slosh around and move, and your capsule can get bigger than we want, and then the implant can sag or go to the sides and do things we don't want it to do.
I never thought about that.
Right.
Okay.
So surgeons always, you can be back to doing stuff in 2 days. No, you can't. Even if you feel great, you should not.
I mean, I've seen surgeons be like, show that you can lift your hands.
Yeah, you can definitely lift your hands. I want people to do that, but no exercise. And it's definitely, don't let them convince you can be back to full Pilates 48 hours after surgery, because even if you feel great, you're going to harm your result doing that.
Okay. I know that you can't lift heavy things like you said.
Right.
And that's for a while.
Yeah, for about 4 to 6 weeks. And usually by 2 months, they're doing anything they want. Even my patients, I have patients, they do like super heavy weight stuff, and they're totally back to normal by 2 months after surgery. So
not bad.
Yeah, it's not bad.
All right, we're getting into scarring. They have a lot of questions for you. I mean, geez.
These are like really great questions.
Yeah,
too.
they're really hitting them. Okay. Is there any way to prevent scar tissue like capsular contracture, especially if you've had them before?
Absolutely. So capsular contracture is a problem where the scar tissue sac, that capsule around your implant, becomes abnormal and thick. And the two reasons typically that cause it is going to be a ruptured silicone implant. And some women, biofilms or low-grade subclinical infections on their implants cause capsular contractures. Biofilm is very common, causes no issues in a lot of people, but some people it does cause contracture. So the ways,
how do you get that? How does that happen?
So you have a natural microbiome of your breast. I hate that word because it's overused, but you do. You have a bacteria through your breast tissue because those little ducts are open through your nipple. And so when you're in there mucking around in the operating room, you're potentially releasing bacteria that can get on your implant. And you also can get bacteria from your skin on the implant. So what we've learned from years of study is that things that we do in the OR to minimize bacteria getting on the implant are going to be very helpful in minimizing contracture. And then you also want to be careful not to damage the implant. So incisions that are this big, shoving an implant through this, it's not meant to go through an incision that big, and you can actually damage the implant on the way in. We have specialty irrigants like hypochlorous acid. We use in the operating room betadine, which is the brown soap everybody's familiar with. Some people use certain antibiotics. I'm a hypochlorous acid girl, as those that follow me probably know, and they do a good job of minimizing bacterial infection. And then also we use a sterile funnel now, most of us, to place the implant. So no contact with the skin, and nobody's touching it with their gloves. It just goes in, and it's less likely to develop problems. Yeah. So that's really the main way to prevent capsular contracture at the time of your surgery.
That makes sense. Best amount of time to wait postpartum to get a breast lift, and even just get your boobs done postpartum.
So I love this question. There's a few things you need to wait for after babies before having breast surgery. So first thing, you want to be back down to whatever your fight and weight is. Just for the same reasons I've already mentioned, you want to make sure that you're not going to lose weight and droop again afterwards. Right. The next thing is you want to be about 6 months out from breastfeeding. And that includes, even if you're pumping, you still want to be 6 months out from that. So the two things that we're trying to prevent are, number one, milk leaks. If you are still making a lot of milk, if we go cutting your breast tissue, we can cause a milk leak, which is an absolute disaster of a problem. You do not want that. So you want to be stopped pumping or breastfeeding for at least 6 months before surgery. And then also you want the breastfeeding to be stopped for at least 6 months, because the baby's mouth bacteria can be in the ductal system, and so it can increase your infection rate. So
oh my gosh, I didn't even think about that. Because you think about the milk going out, but you don't really think about anything going back in.
Right, because remember, those ducts are open through the nipple and the baby's mouth is in contact. So you want to get that mouth bacteria time to leave the system, so to speak, so you have a lower chance of infection.
Yep, never thought about that. Is it worth getting it done before having kids, or should you wait until you're done having kids? Actually, this is a question I see a lot of people. A lot of my friends have even thought about this. Like after they've had probably like their second kid, they're not sure if they want a third kid or not. They're still waiting it out, but then a couple of years can pass. So then they're like, should I be getting my breast implants done? Should I wait till I'm truly done having kids? What's the answer?
I mean, I think the problem is there's no right answer. We don't know what the future holds. And I feel two ways about it. You know, certainly I think it's always ideal to wait till everything's done, but you don't want to have years of your life when your breasts are not bringing you joy when they could be. Yep. I think you need to make a calculated risk. You know, if you are in your 20s and and babies are nowhere even close in the future, get your breast implant.
Yeah.
You know, go for it. Have fun. Have your decade, 15 years of fun with your implants before babies. You can always do things afterwards if they don't hold up through pregnancy, but many women, they do. And then if you're between, you know, baby 2 and you don't know about 3, and I mean, do what brings you joy. I mean, there's no reason to put things off. Life is short. You don't know what's going to happen. And you would hate to, again, have years of being unhappy with something when you could easily solve that problem.
I'll throw out there, I regret not getting my boobs done in my 20s. Had saline not been the go-to implant back then, I would have figured out a way to get breast implants.
Right.
And I would have loved having tits in my 20s when I was single and ready to mingle.
I see a lot of patients, they'll come in their 40s and they have these just giant implants and they're ready for them to come out. And they don't hate them. They're not mad at them. They're just like, it's not good for my 40-year-old self, but I loved him in my 20s. So, you know, they had an important job in the 20s and now their job is over. So we remove them.
Yep. So what are the right questions to ask a doctor, a plastic surgeon, to know that they're the right doctor for you?
So I love this question because not enough people ask this. So the first thing to recognize is that the only type of surgeon that is qualified to do a breast augmentation and breast implant surgery is a plastic surgeon. So a board certified plastic surgeon. So you don't want to see a cosmetic surgeon. That is somebody who did not do an American Board of Medical Specialties recognized training program or sit for their boards. You want a plastic surgeon.
This is like an extra 18 months of your life, right? That you're doing.
I did 8 years of training after medical school to be able to do what I do. And it's extremely difficult to get into. The process is extremely difficult in itself. And you want the best and the brightest in the only, again, recognized specialty that should be doing it. So make sure you want a board certified plastic surgeon. And I think when you're seeing a plastic surgeon, you know, I don't love jack of all trades, master of none. I think that there's such a diversity in plastic surgery. We do train in all of it, but a lot of us end up specializing in certain areas, like just do face, just do body. And so you want to make sure you see someone who does the surgery you want to have done a lot. Mm-hmm. You want a surgeon who is comfortable doing breast surgery, and that's really important. And then look at their befores and afters. The key that will tell you that they listen to you and not to their inner monologue about what they think looks good is that every breast should look different. This doctor should be giving the patient what they want. Some breasts should be tight and perky and big. Some should be little and subtle. Some should be a little bit on the droopier side. You should see a big range of results. There should be some results that you love and some that you don't love. And what that means is that surgeon is giving different results to different people based off of their anatomy and their desires. You don't want a one-trick pony who does the same thing on every patient.
What would you say your specialties are?
So I am primarily breast and body. So I do mostly breast and body mostly in conjunction with breast. So
when you say body, like what parts of the body are your go-to?
Tummy tucks and liposuction is most of what I do these days in conjunction with my breast surgery.
Oh, so all at the same time?
I sometimes all at the same time. Sometimes I split it up. Just depends on how long the surgery is for safety.
And then the last question really is the risks that people should consider when getting augmentation.
Absolutely. So again, no surgery is perfect. You as an informed consumer and a smart person should know the risks of anything that you're taking on. So the main risk for any surgery is going to be bleeding, infection, and injury to things that are not meant to be injured. Bleeding and infection would be more common complications, but they're still relatively rare with the breast augmentation. And injury to things that we don't need to hurt is very rare. And so those things are not common, luckily, but it's important to talk to your surgeon about what that actually means. And then of course, with implants, it's going to be implant related complications. You want to ask your surgeon about breast implant illness, capsular contracture, implants dropping too low and too far to the side, implants breaking. What does that look like? And then it's very important anytime you have surgery, you ask your surgeon, what does this look like as I age? What is the maintenance for this procedure? And do I need any type of monitoring? Because those are really important things you need to know. You don't want to just leave the surgeon's office and go, done. You want to understand how this is going to change with time and what your responsibility is as the patient to remain safe.
Well, thank you so much, Dr. Killeen. If you're in Los Angeles, you can come see her. You know what she specializes in now. If you want to get the boobies done,
I'm your girl.
Little tummy tuck. Where can everybody find you?
So my office is in Beverly Hills and my practice is called The Practice Plastic Surgery, and I would love to see you.
How about on social media?
On TikTok, I'm Kelly Killeen MD, and on Instagram, I'm KL Killeen.
Very nice. Thank you guys so much. Feel free to ask any questions in the comments below or just go ahead and find her. Talk to you soon.